Again, thank you everybody for being here today. I'm Heather Korbulic. I'm the Executive Director of the Silver State Health Insurance Exchange, which is the state agency that runs and operates the online marketplace known as Nevada Health Link. In our current COVID landscape, there really isn't any other lesson that we've learned other than health is wealth. And we have seen an increasing need for comprehensive and qualified health plans on the exchange. And I don't think that it comes as any surprise to anybody that during this COVID era, there's never a more important time to connect to comprehensive healthcare. I want to thank all of our attendees today, and especially our guest speakers, Governor Steve Sisolak, Senators Catherine Cortez Masto and Senator Jacky Rosen, and Attorney General Ford. Thank you all so much for being here today. I think it's so important for people to know that exchange plans are ideal for those who don't qualify for Medicaid or Medicare and who still need financial assistance. We're the only state agency, the only entity that you can connect to get that financial assistance. This year, we're working with 5 different carriers. 2 of them are new to the exchange, so we're thrilled to bring them on this year. And between all of them, we're offering a combined 50 plans, so almost double the plans that we've had in years past. Health Plan in Nevada, HPN or Silver Summit and Ambetter, Anthem are all returning this year, and we're being joined by Friday Health Plans and Select Health. All of our plans are Affordable Care Act compliant. They cover 10 essential health benefits such as mental health, pregnancy, childbirth, prescription drugs, and emergency services, including the coverage of all pre-existing conditions. And importantly, they cover a COVID-19 diagnosis and treatment. There is no need to purchase any additional plans. In addition to health insurance plans, consumer can also explore all of the dental and vision plans that we have on Nevada Health Link this year. Thanks to a new partnership with VSP Vision, we're very excited to be able to offer Nevadans comprehensive vision plans through the exchange. Our rates this year have increased by 4.2%, but that also means that the subsidies available for those who are getting financial assistance are increased too. So most of our consumers will have very minimal, if any, premium cost increases. Nevada Health Link is, of course, the only place you can qualify for subsidies to offset the costs of your insurance. Last open enrollment, 4 out of 5 every consumer got subsidies or had some financial assistance. So we feel pretty confident that most Nevadans that are currently uninsured are eligible for those subsidies, and we're excited about this opportunity to get them connected to comprehensive care. I also just want to acknowledge, and maybe the Attorney General will also acknowledge, that the Supreme Court is going to be hearing this Affordable Care Act case on November 10th. What's most critical for consumers to know is that while that case is being heard, no decisions will be made on it until several months into 21, and we do not anticipate any impacts on plan year 2021. With that, I'd like to hand the microphone over to Governor Sisolak. Thank you, Governor.
Thank you, Heather. I appreciate it for the opportunity to join you today. I'm going to give you just a few brief remarks, and I'm anxious to see what my colleagues have to say. As the governor of the great state of Nevada, taking care of Nevadans is a top priority for me and my administration. Nothing has put Nevadans' good health to the test like the current pandemic that we are facing. And there's no better time than now to ensure that you and your family are covered with quality health insurance. While no one can predict when they might fall ill or become injured, they can give themselves a peace of mind by having health insurance, the foundation to well-being regardless of age, income, or life circumstance. This is the second year Nevada Health Link is operating as a state-based exchange, which means a second year Nevadans can reap benefits such as enhanced user experience on Nevada Health Link, thanks to advanced online features and innovative tools. Not all the healthcare plans are designed the same. As a state-based agency charged with closing the uninsured gap in Nevada, Nevada Health Link offers only qualified health plans that cover the 10 essential health benefits mandated by the Affordable Care Act, as Heather had said, including pre-existing conditions. Many marketplace plans do not come close to providing this kind of coverage. Earlier this year, Nevada HealthLink announced an exceptional circumstance special enrollment period in response to my emergency declaration. During that 2-month period, nearly 6,000 new consumers enrolled in health insurance. When combined with the more than 77,000 consumers who enrolled during the last open enrollment, that makes more than 83,000 men and women who decided to protect themselves this year. But while that number goes a long way to close a gap in our state, there is still much more work to be done. There are still over 100,000 eligible Nevadans without health insurance. 100,000 eligible Nevadans. It has always been my personal mission to better the well-being of families and children across our state, which is why I so strongly support the work being done by Director Korbulic and her dedicated team at Nevada HealthLink to connect Nevadans to affordable and quality health care. Visit NevadaHealthLink.com between now and January 15th, 2021, and enroll in a plan that fits your needs and your budget. Thank you, Heather, and thank you everyone for joining us.
Thank you, Governor. And now I'm going to hand the mic to Senator Cortez Masto. Thanks for being here, Senator.
Oh, thank you, Heather. I'm so excited to join the governor, my wonderful colleague in the Senate, Jacky Rosen, our Attorney General, General Ford, and I see so many other friends as well joining. So thank you. Listen, this is an exciting time for us because we have the ability to really kick off the opportunity to ensure that more people have access to health insurance. The start of Nevada HealthLink's open enrollment period is critical to us ensuring that we address what the governor just said. There's 100,000 eligible Nevadans without health insurance that have the opportunity through this kickoff and the Nevada HealthLink's open enrollment to access insurance. As Heather said, the open enrollment runs from November 1st until January 15th. During this time, if you are eligible and you need or want insurance, this is your opportunity to access it. In the middle of a health crisis, the middle of a pandemic, I can't think of what's more important than having health insurance to your peace of mind, to your family's peace of mind, to address some of the stressors that so many families are dealing with right now because of this crisis. I am proud as a Nevada that we have Nevada HealthLink. So many have fought over the years to ensure after the passage of the Affordable Care Act that we could bring health insurance to Nevadans. And because we have the Affordable Care Act, because we have Nevada HealthLink, as you've heard from both Heather and the governor, over hundreds of thousands of Nevadans have coverage for the first time. That's including 158,000 children. We have strengthened the Medicaid program. Over 640,000 Nevadans rely on and bolstered Medicare as well. Now, Jacky and I and the governor, and we all know this, and General Ford, we see this, and Heather sees this. Too many Nevadans right now are facing uncertainty, job losses, anxiety about their health and their safety right now. That's why this option is so important. And we need to make sure people are aware of it. It's one thing to have it available. It's another to educate Nevadans that it is available to them and make sure we're reaching out to them so they can enroll and get affordable insurance on this exchange. It is more important than ever. As we have seen, all of Nevada HealthLink's qualified plans for 2021 include coverage of the 10 essential health benefits mandated by the Affordable Care Act. That is key. That has brought a peace of mind and comfort to so many people. Unfortunately, we know there is a federal lawsuit right now that's going to be heard before a United States Supreme Court November 10th. And what they are trying to do is take away the Affordable Care Act, rule it unconstitutional, so that no longer would this coverage be available. Now, the good news is what Heather said is that through 2021, you're going to still have that coverage. And I will tell you, through the fight of our Attorney General and so many attorneys, including our colleagues in the Senate and in Congress, we're going to fight to make sure that the Affordable Care Act stays, that you have that coverage, and we expand upon it. One of the things that I think people don't realize is so many people in Nevada across this country need access to health insurance, and we hear from them. I know I hear from them in my office. Jacky and I talk about this all the time. We hear from Nevadans, whether it's through emails, through letters, through showing up at our offices, through video, whatever it is, and now Zoom videos, too many people still need coverage. And so many people have it now. Why would we want to take it away from them in the middle of a healthcare pandemic? This really is a bipartisan solution that we should all be fighting for in this country and in the state right now. So there are opportunities for so many people out there. For those 100,000 that are eligible, there's opportunities to qualify for financial aid as well, so that you can still get healthcare coverage and have the coverage that you need. During this crisis, please know that we were all there ensuring and fighting to make everyone in this state have the coverage that they need for themselves and their families. It is so crucial. So I am so appreciative that we're doing this press conference, but the more that we can get the word out to so many people across this state that we have an open enrollment now, that you can have access to healthcare, you should get on that link and see what coverage that you can afford. And if you can't afford it, there's financial aid. So please know that. Thank you, Heather. Thank you to the team at Nevada Health Link, the Silver State Healthcare Exchange. You guys have done an incredible job. Thank you, Governor, for continuing to fight for healthcare in our state.
Thank you, Senator. Now I'll hand off the mic to Senator Jacky Rosen. Thanks for being here, Senator.
Well, thank you, Heather. And I agree with, of course, the governor and my partner in Washington, Senator Cortez Masto, and thanking you, Heather, your team for working hard. Of course, like I said, I see Attorney General Ford on there doing everything that he can. I see so many other friends on this call, and I am just proud to be part of that team working with all of you, and just always humbled to be representing you all in the United States Senate. But it's important that you hosted this press event, because all the leaders that are here on this call today, we're here to talk about a really important issue. Nothing's more important than our health. And you know, we've always supported Nevada Health Link and all the other ways that you can get your health coverage, because all those 100,000 or even more, possibly during this pandemic, that need insurance coverage, they do have a place that they can get it. And of course, I'm a member of the Senate Health, Education, Labor, and Pensions Committee. And so working through that committee, protecting Nevadans' access to quality, affordable care, it's just one of my top priorities in the Senate. In fact, one of the first actions that I took when I was in the Senate was to help lead a resolution to defend the constitutionality of the ACA and its coverage to protect those pre-existing conditions. Like everyone knows, a week from tomorrow, I believe, November 10th, it is before the Supreme Court. And I can tell you this, I am still as committed today as I was then to protect the ACA, along with Senator Cortez Masto, on this call, the governor, the attorney general, all of you here, all of our partners. We are committed to protecting healthcare, not just one day, but every day. And this year, you know, the ACA is now 10 years old. It's crucial that we do every single thing that we can to defend the law from all the attempts to dismantle it, because all the hard work that all of you have put in, and so many others, all the progress we've made over the last decade, it just could be erased. And we have to protect those pre-existing conditions. We have to provide those 10 essential health benefits. They are just critical. We have to expand access to the millions of Americans, and of course, the hundreds of thousands of Nevadans that need care. And I don't need to remind anyone that we are in the midst of a global pandemic. It's impacted far too many, and healthcare coverage, while it is always important, it is more important than ever. I'm glad to hear you say, Heather, that all of your plans do cover COVID-19, because we're not sure what kind of health issues that is going to, that the pandemic, that COVID-19 is going to carry with it. going on into the future. But today we're here for the specific reason to be sure that we encourage all Nevadans to explore coverage options on the Nevada Health Link. There are plans that are suitable for you. Like you said earlier, 50 plans are out there, so you should be able to find one that fits you, fits your family's needs. And those many Nevadans that are uninsured, 100,000 plus, they may actually be eligible for help paying for their coverage. So if you, anyone listening on this call, you, a family member, a friend, if you need coverage, go check it out. See what you qualify for, including the expanded Medicaid. Many people, it does show many people qualify for assistance. They don't even realize it. We have tax credits that help you pay for your plan on the Health Link. And so please check it out. There may be more help than you or your friends realize. It's very important. And so I'm just so proud to be here with the rest of Nevada's leaders on this. We are all committed to the mission of protecting the health and well-being of every hardworking Nevada family. And nothing is more important than your health and the health of the ones that you love. So I just have to give the final pitch. Remember, tell your friends, tell your family, see what options are available to you. Make a plan to enroll. Enroll today, don't wait. The open enrollment started yesterday. It goes all the way to January 15th. Don't wait to the end. Do a little bit of research. Go on Nevada Health Link, find a plan that's right for you, talk to someone there, and just get covered. It's so important. So I'm going to throw it back to you, Heather, and thank everyone for their hard work.
Thank you so much again for being here, Senator. And I'd love to now hand off the microphone to Attorney General Ford. Thank you for being here, sir.
Well, thank you so much. Hi, everybody. I am Aaron Ford, your Attorney General, and I'm delighted to be here with Governor Sisolak, Senators Cortez Masto and Rosen, and of course, you, Heather. Thank you so much for inviting me to join the Nevada Health Link and for this virtual panel on open enrollment. This year, as we all know, has been difficult for everybody, and I could actually stop my comments by saying that and ditto to everything that's already been said by the governor and the senators. We're all struggling, and it's important for us to recognize that and to know where we can turn for help. Open enrollment is, of course, a time for you and your family to enroll in health insurance, and this year your health care is that much more crucial than ever. And the state of Nevada, as you've heard already, is fully invested in your health and your safety. And I encourage everyone to sign up for your health coverage. You've heard already the senator and the governor, the senators and the governor talk about the importance of it in Nevada. And you've also heard that, yes, in a week from tomorrow, some colleagues and I will be arguing for the defense of Obamacare. One of the first things I did, if not, frankly, the first thing I did when I was sworn in was to join into the litigation to protect Obamacare. Because our previous administration did not do that. So we are fighting, and let me offer you a couple of reasons why this is important. You've already heard about pre-existing conditions and about Medicaid expansion, but let me tell you what else would be gone if Obamacare is eradicated under the Supreme Court. And the reason why it's not just Nevada that's fighting, it's a coalition of at least 24 attorneys general who are fighting. We're looking at protections for 135 million Americans with pre-existing conditions. Those will be gutted. More than 20 million Americans will lose coverage. The uninsured rate will obviously increase, and the estimation is by 65%. Medicaid expansion, which covers 17 million people. Nearly 12 million seniors will have to pay more in prescription drug prices because the Medicare donut hole will be reopened. Protections for older Americans that prevent them from being charged as under an age tax. 2.3 million adult children will no longer be able to stay on their parents' insurance. Insurance companies will be able to charge women more than men. Financial assistance that helps 9 million people purchase health care in the marketplace will go away. Key support for rural hospitals, which is extremely important in our state, will be eliminated. As Americans lose coverage, already struggling hospitals will be hit even harder as their costs increase. We're hearing about states that did not expand and did not accept Medicaid, and we're seeing during the time of COVID that they are having problems. South Carolina comes to mind, and the conversation is around the importance of Obamacare in that circumstance. The ban on insurance companies having lifetime caps on coverage is at risk. Requirements that insurance companies cover prescription drugs and maternity care. And I could end there, but wait, there's more. Rules that ensure your hard-earned premium dollars go to your health care and not insurance company profits. That's at stake. Contraceptive coverage for 60 million people who now have access to birth control with no out-of-pocket costs. That's at stake. Consumer protections that prohibit drug companies from paying off doctors behind closed doors to influence the drugs they prescribe to patients. That's on the line. A ban on discrimination against women, LGBTQ Americans, and individuals with disabilities in healthcare settings. Essential protections for breastfeeding parents, including workplace standards and access to breast pumps with no out-of-pocket costs. Legal authorization for the Indian Health Service, which provides basic health care to 2.6 million American Indians and Alaska Natives. Medicare and Medicaid's authority to test key provisions, key programs that save money and help Americans receive better care. And something that we've now become accustomed to, calorie counts on menus at restaurants, is also something that's going to be affected. I can keep going on and on and on, and I've given you a non-exhaustive list of why it's so important that Obamacare stay intact and why we're fighting so vigorously in my office and with my coalition of attorneys general to do so. I'm proud to stand on this panel with Senators Cortez Masto, Senator Rosen, and Governor Sisolak, because we are, in fact, as I've indicated, dedicated to ensuring that your health is protected. So take advantage of open enrollment. Started yesterday, goes to January 15th. And Heather, thank you for the work you're putting in. We couldn't do it without you. So thanks so much.
Thank you so much, Attorney General Ford. Just a few closing remarks before we go. I just want to remind everybody that health insurance is, by its very nature, intended to protect consumers from financial ruin. It's designed to improve your access to quality health care and provide coverage and peace of mind for illness and injury that is often and most likely unanticipated and unintended. No one, regardless of age, income, or health status, should be without insurance. I also want to remind everyone that's watching your various channels that we have over 700 brokers and navigators across the state who are on call and ready to answer your call and connect you to any one of these plans. Insurance can be complicated. Make sure you're working with one of our licensed professionals. This is a free service, and so we are really pleased to have all of these partners all throughout the state available. They can help you virtually or by phone, or even some of them are having walk-in appointments. We have navigators who speak all sorts of different languages, so please don't be shy. We can connect you either to one of our multilingual navigators, or we can work with you through Google Translate and make sure that you get access to advice in your preferred or your native language. So those of you who enroll by 11:59 p.m. on December 31st will have health insurance that starts on January 1st. Anyone who enrolls between the 1st and the 15th will have coverage start dates of February 1st. There are 74 days left to get enrolled, but like other speakers have said, please don't wait. Get connected today. We're standing by and ready to help you. You can call us at 1-800-547-2927 or visit nevadahealthlink.com, and we're more than happy to connect you to one of those navigators or brokers. Again, thank you to all of our speakers. Thank you so much for your support. Thank you for being here today. And let's get out there and do this, people. I'm so excited about another good year. Thanks for being here. Have a good one.
Thanks. Bye-bye.